Hello, today's topic of discussion is urinary tract infection. So we'll discuss definition, etiology, classification and the risk factors of urinary tract infection. So urinary tract infection means invasion and multiplication of microorganisms in any part of the urinary tract. So urinary tract means it starts from the kidney, ureter, urinary bladder and urethra. So infection in any part of these structures are known as urinary tract infection or UTI in short. Now come to classification of urinary tract infection. On basis of underlying defect, it can be simple UTI or it can be complicated UTI. Simple UTI means when UTI is occurring in structurally normal urinary tract, and complicated UTI occurs in pre-existing metabolic, functional or structurally abnormal urinary tract. Based on symptoms, UTI can be symptomatic UTI or asymptomatic UTI. Based on the region involved, it can be upper UTI known as pyelonephritis. This involves the kidney, and lower UTI which involves the urinary bladder known as cystitis, and urethritis is infection in the urethra. Now, what is recurrent UTI? So recurrent UTI is when UTI occurs 2 or more times in 6-month duration, or when UTI occurs 3 or more times in 1 year duration in a child. So this is known as recurrent UTI. Now come to the incidence. 1 to 3% of the girls and 1% of boys have urinary tract infection in their lifetime. The prevalence is different at different age groups. Newborn, male, it is occurring with equal frequency in males and females. In first year of life, in male, it is 2 to 5 times more common than the females. After 1 year, the male to female ratio is 1:10. That means in females, it is occurring 10 times more than the males. So the reason for the newborn, the mode of infection is hematogenous spread, so which occurs equally in both males and females. So neonatal period, the frequency is same in both sex. In first year of life, urinary tract infection occurs more in the males because the main reason for urinary tract infection is congenital anomalies in the male. So usually these congenital anomalies are diagnosed by age 1 year, and it is more common in males, so UTI is occurring more in the male than the female. Whereas after 1 year of age, the mode of infection is ascending infection, and females having a shorter urethra, they have a much higher incidence of urinary tract infection than the males. Now come to causes of UTI. So the bacteriological causes, the microorganisms causing UTI. So starting with the bacteria, gram-negative bacteria is the commonest, and out of that 80 to 90% is by E. coli. So this usually occurs due to fecal soiling. Second is Proteus, 30%. Then Pseudomonas aeruginosa and Klebsiella pneumoniae, they can also cause urinary tract infection. Amongst the gram-positive bacteria, Staphylococcus streptophyticus, 5 to 15%. Enterococcus, Citrobacter, Staphylococcus aureus, which is rare. And some other groups, group B Streptococcus usually is commonly seen in the neonates. And then Haemophilus influenza is other bacteria causing urinary tract infection. Now virus, Epstein-Barr virus, adenovirus, enterovirus, Coxsackie virus, ecovirus. And amongst the fungus, Candida species, Aspergillus species, Cryptococcus neoformans, all these can cause UTI. And the parasites, pinworm infections is one of the cause for UTI in case of children. Now come to the risk factors. Risk factors is divided into host factor, organism factor and the environmental factors. So starting with the host factor, number 1, in an individual or in the child, if there is anatomic and functional renal abnormalities, this is a risk factor for urinary tract infection. Number 2 factor, urinary stasis is one of the very important risk factors, and which is preventable also, and is one of the commonest cause for urinary tract infection. So 30 to 40% of this urinary stasis is caused by the obstructive uropathies. So obstructive uropathies means obstruction occurring anywhere in the urinary tract, which can occur in PUV, that is posterior urethral valve, PUJ, that is pelvic-ureteric junction obstruction, VUR, that is vesico-urethral reflux, where urine is refluxed back to the urinary tract, and then stones also cause obstruction. Ureterocele, it's a congenital anomaly, it also causes a obstruction. And second is voiding dysfunction occurring in neurogenic bladder. So neurogenic bladder, neurologically weak functioning bladder, so there is a voiding dysfunction, so collection of urine is there. Third one is infrequent and incomplete voiding of the urine, so usually occurring in children, so they void the urine infrequently and incompletely, so the urine remains collected in the urinary bladder and then acts as a source of infection. Number 3 cause urethral instrumentation, so that is the catheterization we do, and then labial addition. Age and sex we already discussed. Genetic factors, parents, siblings, first degree relatives, if has a UTI, there is a high risk of this child having UTI. If there is a recurrent UTI in the family members, this child may have a recurrent UTI. And if the child is immunocompromised, which usually occurs in malnutrition or diabetes mellitus, there also urinary tract infection risk is high. Uncircumscribed male. Number 11, length of the urethra. Females having shorter urethra, higher risk of urinary tract infection. Urine itself is a media for growth and poor urine flow. Risk factors in the organisms. So in this, the type of organism, bacteria, virus or fungus, and which type of bacteria, all these are responsible. And presence and expression of virulence factors. So the virulence factor of different organism is different. Some has a higher virulence causing higher chance of infection. And size of the inoculum, small or large. So larger inoculum may have a higher risk of infection. Now the environmental risk factors. The female genders, uncircumscribed male, wiping from back to front, especially in the girls, which will cause a fecal contamination, soiling, so high chance of UTI. And wearing tight clothing or tight underwears is another risk factors. The mechanism of the disease are by 2 ways. So number 1 is the ascending infection, so that is from down to above the infection is spreading. So in this, short urethra in females, fecal soiling and voiding dysfunctions are the examples. And hematogenous spread is occurring only in 4 to 9% cases, and this occurs usually in the neonates, in GI disease with a peritonitis or sepsis, and if the child is severely ill with a multi-organ disease, then also hematogenous spread can occur. Thank you. We will discuss another topic in the next class.